Beginning in late 2019, the SARS-CoV-2 virus, commonly referred to as the COVID-19 virus, spread quickly across the world, devastating the lives of people globally. In September 2020, the British Academy was invited to assess the long-term societal implications and impacts of the COVID-19 pandemic. Professor Dominic Abrams, Professor of Social Psychology and the Director of the Centre for the Study of Group Processes at the University of Kent in the UK, was the main academic lead for this multidisciplinary review.
We decided to look at three general areas of policy focus. One, health and well-being. Second, community culture and belonging. The third, knowledge, employment and skills. And for each of these areas, we looked at several cross-cutting themes, and these involved governance, the way that things were being managed and organised, trust, the extent to which people were willing to comply with various restrictions and rules, cohesion, the extent to which people were working together to deal with the problems facing them, how this was impacting levels of equality and inequality, and the extent to which there might be implications for sustainability.
The study considered several themes under health and well-being. The United Kingdom had many pre-existing health inequalities prior to the pandemic, and the research confirmed that those who were most deprived had the highest COVID rates. Age was also an important factor, and in general, older people were more likely to be hospitalized. However, at a local level, variations to this pattern were noticed.
Older people living in Trafford, area in Manchester, relatively well-off area, an area of low deprivation, was doing very well. They had few hospitalizations and deaths, whereas those living in Salford, an area of high deprivation, younger people actually were particularly badly affected. So the specific effects of the virus and the pandemic were not just simply a function of age or simply a function of poverty, but often the combination of the two, as well as the particular location and place where things were happening.
In most countries, substantial impacts from the pandemic were seen in the areas of employment and education. In the UK, the study highlighted rising unemployment, particularly among the young and less educated population. Despite various programs offered by the government, considerable job loss and lack of apprenticeships were noticed, and many in casual forms of labour and the self-employed received less support. The effects of the lockdown were also disproportionate.
The higher one's income, the greater freedom one had not to behave as if in lockdown or not to be restricted by lockdowns. But equally, if we look at people who are able to work from home, we also see a similar type of gradient, which is that those people who are actually least affected by lockdown itself were also much more likely to be able to work from home. So the working conditions and the constraints and the complexities of dealing with those was much greater, and the freedom in a way to avoid the virus as well was much greater as you moved up the income distribution.
In the education system too, students from poorer backgrounds were more severely affected by the pandemic. Private schools were typically able to continue work online, while state schools were not able to do so. Access to private tutors were also significantly greater for the richest quintile of students. This has had an impact on other types of outcomes, such as access to the best universities.
So three types of inequalities seem particularly likely to be exacerbated. Income inequalities between the richer and poorer households, socioeconomic inequalities in education and skills, and also intergenerational inequalities between older and younger people and between proximal generations of students and children.
A key focus of the study was the influence of the local community on the pandemic response. While trust in the authorities and community cohesion levels fluctuated nationally, at the local level, trust and cohesion levels were largely sustained. This helped to generate compliance with many of the rules and regulations.
Now, what we saw, I think, in the UK and will be true elsewhere, is that where you have a strong local infrastructure and strong local networks, that it's possible to sustain norms and to use local informants, as it were, local experts to help guide people's behaviour, for example, to encourage them to take vaccines. We found that communities that were better supported in terms of investment in their cohesiveness tended to fare better as well through the pandemic.
However, trust in the authorities was not the only reason that affected vaccine uptake in the community.
I think those who, certainly in the UK, who haven't been vaccinated, there are very many reasons why not. One of them is simply complacency, which is the sense they may be not vulnerable to the virus. Another is concern that they may be more vulnerable to side effects of the vaccine than of the virus. And the third reason is indeed their distrust in government, that the government has some ulterior motive. But actually, we've done some research that reveals something we call distrustful complacency, in my research group, where actually it's the combination of feeling complacent and distrusting the government that seems to be most predictive of not taking vaccines.
Based on the results of the research, the British Academy recommended 7 strategic policy goals for the UK. These included building multi-level governance structures, reimagining urban spaces to support sustainable businesses, investing in digital infrastructure, and strengthening community-led social infrastructure.